Community Health Heroes. Did you know that the epic rainfall in August 2016 damaged more than 146,000 homes throughout Louisiana, caused about $15 billion in damages, and ranked as one of the most expensive natural disasters in modern-day history? With us now are Karl, the COO of the UnitedHealthcare Community Plan of Louisiana, and Sam Sanders, Executive Director of the Mid-City Redevelopment Alliance. Due to a substantial $250,000 grant, both organizations are helping families recover after the storm. Thank you both so much for being here today. Sam, I want to start with you. Tell us a little about what the Mid-City Redevelopment Alliance does and why you felt motivated to help the people in North Baton Rouge in particular after the floods in 2016.
Sure. So Mid-City Redevelopment Alliance has been around for 27 years. We're a nonprofit organization. We were created by a local hospital. And the focus of it was to just kind of stem the tide of disinvestment in the area just outside of downtown Baton Rouge. And we've been in the community doing work for a very long time. And fortunately for us, when the flood happened in 2016, our area did not take on water. So it made us nimble enough to be able to do whatever needed to be done. So we just went in North Baton Rouge and did what we could to help as many people as possible.
And Karl, I know UnitedHealthcare did a lot too. You gave this $250,000 grant, of which organizations like the Mid-City Redevelopment Alliance was chosen to give $100,000. Can you explain a little bit why you gave that grant and why Mid-City Redevelopment Alliance got a piece of it?
You know, when the flood hit, there was an immediate call to action, and that's big at UnitedHealthcare. Giving back to our community and doing what we can to help. And we got out there where the people were, in community centers, the shelters, and seeing, you know, the effect on these people. But when we came back, you know, we met as a leadership team and we knew we wanted to do something more. And we requested $250,000, and fortunately we were awarded that. From there, we turned and awarded it to the Baton Rouge Area Foundation.
And you acknowledge that this UnitedHealthcare grant was basically the cornerstone of all your efforts. Can you tell me about some of the progress you made and what you've done with the money?
Sure. I mean, it really made all the difference in the world, because what happened with this particular weather event is that the national response was not this big, robust response. So a lot of people around the country didn't even know we were suffering that way with that many people affected by the flood. So having groups like UnitedHealthcare actually step up and make an award like that, I mean, I can tell you, near tears in the office when we heard that we were getting this. Because at first we didn't believe it. We thought it was a scam or something like that. And I had to call back and talk a few times just to make sure it was real, because I was in DC at that time.
That's a lot of money.
It was, I mean, definitely. And I immediately thought about what I could do with it. So that's really what was so overwhelming in that process. But it really made the difference in our being able to really equip the folks that we had working in these houses with all the materials that they needed to get in and do as much as they possibly could.
Karl, you mentioned the word partnership. Could you tell me what you've been most proud of specifically with this partnership and the results that you've seen?
You have to think about the residents. You know, you look at what happened, you know, the 100,000 plus that were affected. And when you get out there and see the devastation, I personally went out and drove around, and to see, you know, there was barbecue pits, they were cooking breakfast, lunch, and dinner, you know, to try and survive. And to see the type of work that you've done to get these people back into their houses. They had to struggle. It wasn't just get back to their house. They had to live in their house that was not, you know, they couldn't live in it. But they had to go to work and figure out how to survive. And this group has done an outstanding job of helping those citizens recover.
Sam, tell us a little about the Mid-City Vista Dream Project. What is it?
So that's a national service program. It's an AmeriCorps program, and they refer to themselves as the Domestic Peace Corps. It's an easy way to reference who they are and what they do. Some years ago, we actually expanded our program, so now we actually have 20 members who serve with us on an annual basis. And what we do with them is a few of them serve in our office as full-time extensions of the staff, but the majority of them are hosted by other nonprofit organizations in the community, and it allows us to collaborate better and extend the capacity of some of those different organizations. So we were even able to use them. 4 of those core members were dedicated to disaster response during the flood recovery effort. And it too made a difference, because it allowed us to make sure that the warehouse where we received so much, it could actually get out to the people who needed it.
Well, I wanted to ask you about that warehouse. I think is that the MCRA facility?
Mm-hmm, yes.
Now that's only going to be open till the end of December, is that right? How can people take advantage of the help they can get there?
So they can call our office, 346-1000, 225-346-1000 is our number. But we're partnering with United Methodist Church, who's actively still rebuilding homes. They're going to take possession of the materials, but we can still connect people to some of those materials as long as they're available.
So even though there's a technical December cutoff, it's still going to be, the resources are still available.
Sure, right. We're just going to shut down the warehouse itself so we don't have a staff person to run that space anymore. But we're going to make sure that it's where it can be used. And if I still need to pull it to help get projects done, I can do that as well.
Carl, this next question may sound a little silly, but when people think UnitedHealthcare, I mean, you kind of think insurance.
Sure.
So it's so interesting to hear that the organization, the company is so involved in this type of outreach. Can you tell us a little about that philosophy with UnitedHealthcare? Why, they really try to do this outreach and especially help people in Baton Rouge?
Absolutely. And, I have to say I'm blessed to work for such an amazing company, and it does go well beyond just insurance. When you think about the members we serve almost 500,000 members that are very well underserved. So we have to look at the holistic approach to these members, not just insurance. So you're looking at behavioral health, you're looking at social determinants of health, affordable housing. This is important to their overall health. So that's one big piece that we do outside of just insurance. And, when you look at this storm, I mean, it truly put us all to the test. And all the citizens, but many of our members were affected by this. So we had to get out and do what we could to help them recover, get their lives back, outside of all of these other dynamics they had to deal with. And, as we look at UnitedHealthcare, we have over 700 employees that live here. So we had well over 200 that were also directly affected. So we got out to help them rebuild, get them hygiene kits, get them, cleaning kits, and help them get back on their feet as well. So
it's been about, a little more than 2 years. You think some people are getting back to normal?
They are, but there's still some that need help.
Well, if some people want to help you, help them, how do they get in touch with the Mid-City Redevelopment Alliance?
Well, they can call us at 225-346-1000 or find us on the internet at midcityredevelopment.org.
Great. Well, thank you again both for stopping by, telling us all about this and about the recovery efforts. It sounds really exciting, very positive.
Thank you.
Thank you. You bet.
When we return, how local kids are keeping fit exergaming with UnitedHealthcare donated Nerf Energy game kits. We'll show you more right after this.